Happy Saturday, and thank you for joining me today. Hope you had a great week. So great to have you here this weekend. There's lots to get to today. I know you are tired of hearing about this subject. I've been covering this for more than 9 months now here on the Jeremiah Patterson Show. But we just have to pull through. We have to wear our mask and do the best we can. Okay, deep breath. All right, we're going to begin tonight in a small town in Kansas. The town is called Norcator. The population there is about 152 people. This was reporting from The Guardian earlier this week. Quote, "It's barely a town anymore. Battered by time on the wine-spent prairie of northwest Kansas, COVID-19 still managed to find Norcator. Not much remains of the rural hamlet, save for a service station, a grain elevator, a little museum, and a weekend hangout where the locals play pool, eat pizza, and drink beer. The roof has collapsed on the crumbling building that once housed its bank and general store. Schools closed decades ago, and the former high school building is used for city offices." End quote. Well, little Norcator, Kansas has just taken a big step, has just done something that's pretty huge for them by canceling the beloved Norcator Christmas drawing. And that is very, very big. Because of the coronavirus pandemic, and because the coronavirus pandemic has reached the rural United States, this is how residents in Norcator, Kansas found out that the annual Norcator Christmas drawing was canceled. Quote, "Due to individuals who have COVID and refuse to stay home in quarantine, it has been determined it is not safe for the citizens of Norcator and the area to proceed." End quote. So that was a Facebook post essentially informing the residents in Norcator, Kansas, hey guys, we're not going to be able to do this thing this year because of the negligence of some of the residents here in Norcator, Kansas, who are not willing to self-quarantine after being exposed to the coronavirus. The Guardian further reports, quote, "It blamed negligent attitudes of lack of concerns for others for the cancellation. In a decades-old tradition that evokes Norman Rockwell nostalgia, the whole town typically gathers for a potluck dinner at Christmas time." End quote. This year, that will be canceled. So that has just taken place in small town Norcator, Kansas. Statewide, Kansas has more than 155,000 coronavirus cases and more than 1,529 deaths. This was a local report out of Kansas on Wednesday this week, just the day before Thanksgiving.
It's like Groundhog's Day.
It's awful.
I think they'd be shocked.
They're the voices of nurses 9 months into a pandemic.
If people could see into what you see every day, what would they see?
I think it would frighten a lot, but also be very knowledgeable for many to see truly how horrible this can be.
It's room after room after room of people maxed out on oxygen.
Kristen from St. Luke's.
There's no relief.
Amanda from St. Joseph.
It's emotionally difficult.
And Katie from North Kansas City Hospital have all seen the devastation of COVID in their ICUs through thick layers of masks, shields, gowns, and grief.
Hearing the families cry over the phone and you just want to give them a hug, but you can't.
We're kind of their last chance at life, and so we're trying to just give it our all.
All is a maxed out, at capacity, stretched thin hospital system in Kansas City, with nurses warning they don't want to see you in the ICU with the latest surge of this virus.
I would rather you see grandma and grandpa over a Zoom call or something like that than see them on a ventilator and us be doing a FaceTime or a Zoom call from the ICU to you, because that's the last time you get to see grandma or grandpa.
It's time to RSVP no. It's no to the in-person baby shower. It's no to that wedding in December. It's no to Thanksgiving. It's no. We've got to start saying no to these things now so that we can cap this out and come back down and not repeat what other parts of the country have done. And the only way to do that is to change what we're doing.
Matt Fleener, KMBC 9 News.
Once again, that was a local news report on the coronavirus pandemic from Kansas. Doctors and nurses essentially urging people not to do these things. For instance, birthday parties, baby showers, and these other things that many people commemorate to celebrate with their families, not to do these things because of the exponential increase in coronavirus cases, not only in Kansas, but around the nation right now. Earlier this week, a Kansas study discovered that mask mandates are effective when it comes to slowing the spread of the coronavirus. And it's actually quite interesting because according to the CDC, Kansas issued a face mask order, and counties that opted out saw COVID-19 cases rise 100% in just 6 weeks. So if you've been a little bit skeptical about face masks, here's proof that wearing them actually works. It actually really is effective. In the great state of Massachusetts, also known as the Bay State, they have been battered by the coronavirus for months now, and the situation there is only getting worse. After a peculiar move by skipping over Thanksgiving to report coronavirus cases after that delay, yesterday they finally did report more than 4,464 new cases and 29 deaths. Yesterday, Tanner Stinning reported at MassLive.com, quote, 81 Massachusetts cities and towns now considered high risk for COVID spread according to new data, end quote. Yesterday, CBS Boston News reported that at least 482 people in Massachusetts schools have tested positive for COVID-19 just in the last week. Dacia Moore reported at the Boston Globe yesterday, quote, across the state, long lines for COVID-19 testing reflect a bigger problem, end quote. Here's the lead on her article, quote, plan on getting tested for COVID-19? Bring your mask, a bottle of hand sanitizer, and if you have it, a heap of patience. Driven in part by holiday plans and fears of exposure amid a second wave, a record number of Massachusetts residents are seeking tests. At many testing sites, particularly the appointment-free locations meant to offer convenience, test seekers are greeted by long lines that wind around buildings and blocks through parking lots and playgrounds. Waits can extend for hours as staff struggle to test hundreds of people who suddenly and urgently want to know whether they have COVID-19. But don't expect the long lines to dissipate anytime soon. Experts warn the serious shortcomings in the state's testing infrastructure, including inadequate space and staffing, have left providers ill-equipped to meet the demand for testing as the pandemic's second wave crashes over the state, end quote. Reportedly, Massachusetts' testing infrastructure is one of the most robust in the nation. Over the course of this pandemic, the Bay State has performed more tests per capita than all but 3 states, which are Alaska, Rhode Island, and North Dakota. That's according to data from Johns Hopkins University. We know that there are at least 300 testing sites in the state, ranging from privately run urgent cares to pharmaceutical health centers. These centers with the state are working with the state to render free test kits and to render free tests in high-risk communities. For these testing centers, walk-ins or drive-ins are available. However, lately, nearly all are full. Reportedly, more than 22.7 million tests were conducted in Massachusetts in the week leading up to Thanksgiving. Massachusetts' Republican Governor Charlie Baker said in a statement at a press conference on Monday that this probably transpired because people were hoping to test negative before traveling to visit their friends and family across the country for Thanksgiving. However, as Governor Baker and the CDC have been saying, testing negative does not really mean you're negative given the current incubation period. Also, testing negative does not and won't prevent the spread of COVID-19, given if you're going to be congregating in large facilities with lots of people. But for the testing part of this story, Dacia Moore reports at the Boston Globe that experts and healthcare professionals are indicating that the long lines don't reflect the current holiday season inconvenience, but, quote, a series of long-standing logistical hurdles and inadequacies that have left the state scrambling for resources amid a second wave, end quote. And also, as was alluded to earlier in the piece, the staffing shortages that they are seeing right now in the midst of Massachusetts' second wave. So that's the current situation in Massachusetts. In Connecticut, where coronavirus cases are continuing to rise, Governor Ned Lamont has just announced a $10,000 fine for any Connecticut businesses in violation of COVID-19 rules. The governor is also urging 100% compliance, as COVID-19 hospitalizations are the highest since spring. In a news conference on Wednesday, Governor Lamont said, quote, "We know that the next few weeks are going to be complicated," end quote. In Connecticut, coronavirus hospitalizations have surpassed 1,000, but the good news is that their positivity rate has declined. If you travel a bit down, you find yourself in Pennsylvania, where coronavirus cases are just going through the roof right now. On Thanksgiving Day, Pennsylvania broke a record, recording more than 8,500 new coronavirus cases. Yesterday, the number declined to 7,360 new cases. Nicole Brambilla reports at LancasterOnline.com, quote, "The alarmingly high number of cases heading into the holidays has health officials bracing for a surge upon a surge, with models projecting that Pennsylvania could see more than 20,000 COVID cases a day next month. The projections also show that the states could be running out of ICU beds by mid-December," end quote. Yesterday, Eugene Tauber reported at the Morning Call that Pennsylvania is now seeing an exponential increase in hospitalizations, which probably does explain what Nicole Brambilla reported at Lancaster.com with those projections showing that they could potentially run out of ICU beds by mid-December. In Wisconsin, it's as if doctors are finally catching their breaths as multiple news reports confirm a decline in coronavirus cases and deaths. Wisconsin has been continuing to report thousands of coronavirus cases and hospitalizations, and also hospitals being overwhelmed, seeing patients flooding their doors just continuously. Last weekend, I read a letter that Wisconsin doctors and nurses wrote to the citizens of the state, urging people to stay home, to protect themselves, and to wear a mask and not to travel for Thanksgiving. We will, of course, see in the coming weeks if those warnings were actually heard, if those warnings were actually obeyed and listened to, being that will reflect in the numbers. Yesterday, TMJ4 News reported, quote, coronavirus claims nearly 300 Wisconsin nursing home residents in just 4 weeks, end quote. Speaking of nursing homes, on Wednesday, the Wall Street Journal reported that coronavirus deaths have reached more than 100,000 in nursing homes and long-term care facilities. Yesterday, NBC News did an investigative report on the rise in coronavirus cases in nursing homes. Take a listen.
Families visiting loved ones at Jewish Senior Services in Bridgeport, Connecticut have to meet in a tent. Last spring, when COVID first hit, CEO Andrew Banoff says they were much less prepared. 22 residents died.
I cried myself to sleep at night, recognizing that we didn't have the tools to care for people that we are here to serve and care for. So it was very difficult.
What were you lacking then?
Most importantly, it was knowledge.
Now there are guidelines. They've stockpiled PPE. Staff and residents are tested weekly. But COVID is raging back. They lost 2 residents last Friday.
So in many ways, it's exactly the same. We still have the fear. We still have the uncertainty. We still don't have a vaccine.
With more than 20 staff infected now, nurses who are well are covering.
I see the people who live here more hours a day than I do my family at home. They are our family also. And it's hard.
Nursing homes across the country are still reporting shortages. A review of federal data by NBC News shows 1 in 10 facilities said they did not have a week's supply of N95 masks. Nearly a third of all nursing homes said they had to wait 3 to 7 days to receive COVID-19 test results.
We still lack rapid turnaround testing in most U.S. nursing homes. That needs to change.
More than 1,300 nursing homes across the country had 3 or more COVID cases, the highest number ever reported in a single week. Midwestern states are particularly hard hit. In Iowa alone, there are 3 or more cases in 56 facilities.
We are in the middle of it here at Friendship Haven.
2 hours from Des Moines, in the small city of Fort Dodge, CEO Julie Thorson is angry and frustrated people are not wearing masks. Community spread, fueling more cases than they've ever seen.
I actually have people say, well, if your employees wouldn't bring it in, we're not the villains. We're not the ones that, aren't doing what we're supposed to do. The community needs to step up now.
It's why she and her staff keep posting pleas.
So from us to you,
To protect the most vulnerable. Kate Snow, NBC News, Bridgeport, Connecticut.
Once again, that was an investigative report conducted by NBC News yesterday. Yesterday at Business Insider, Sarah Al-Arashani published her interview with the mayor of Fargo, North Dakota, which is one of the largest cities in the state. Ms. Al-Arashani asked the mayor, quote, "The state as a whole has been able to avoid terrible COVID-19 outbreaks in the spring and in the summer, but now it has 105 cases per 100,000 people. What happened that caused the state to now have one of the worst outbreaks ever?" Mayor Tim Mahoney responded, quote, "When we first started, we thought we were lucky. We thought we outsmarted this virus, which of course we didn't. But part of what drives our numbers to be so high is that we do contact tracing, and we're trying to test people that might be positive. We're just a small state with 770,000 people. So we're doing more testing for capita than any place in the country. But we're having a tendency to test more high-risk people. So you're testing, contact tracing, people are close to somebody who is positive. The community spread is moving faster than it's ever done." End quote. I'll make sure to link that full interview in the description of this episode so you can actually access that information. It'll be, and if you don't find it in the description of this episode based off which platform you're listening to, I know lots of you guys listen on various platforms, listen to the show. So if you don't find that, just go to our website, which is the Jeremiah Patterson Show, and it'll be linked under the coronavirus section. On Wednesday, NBC News had this headline, quote, "As South Dakota takes hands-off approach to coronavirus, Native Americans feel vulnerable," end quote. A member of the Cheyenne River Sioux tribe said, quote, "It's like we're trapped in a house on fire and we're doing our best to put it out," end quote. In Los Angeles, California, they have just issued a stay-at-home order as coronavirus cases are continuing to surge. Earlier this week, Newsweek.com reported, quote, "Californians flock to Pasadena restaurants over Thanksgiving as state breaks record for COVID infections," end quote. This was the headline at the Los Angeles Times yesterday. Quote, "New COVID-19 spike spreading to all corners of California." Yesterday, this was the headline at the Star Tribune in Minnesota. Quote, "Minnesota shatters daily record of COVID-19 deaths with 101. End quote. Yesterday, this was the headline. This is one of the headlines at the Dallas Morning News. Quote, "The rate of COVID-19 patients in North Texas hospitals have just crossed Governor Abbott's red line. One smaller hospital in North Texas said it was at 120% capacity before Thanksgiving," end quote. As coronavirus cases are continuing to rise in Houston, Texas, Mayor Sylvester Turner said that curfews could be coming to Houston, Texas, could be coming if coronavirus cases are continuing to surge. I've played continuously on this show, the judge, Harris County Judge Lena Hidalgo, essentially talk about the exacerbating pandemic there in Houston, Texas, as they are grappling with this, essentially urging people to stay home as coronavirus cases have gone up 250%. Just astonishing. In Oregon, as they are seeing a increase in cases, a gym was fined $90,000 for violating a COVID-19 order earlier this week. Yesterday, Illinois surpassed 700,000 coronavirus cases and topped more than 12,000 deaths. On Thanksgiving Day in Illinois, 131 people died from the coronavirus. Earlier this week, Dr. Anthony Fauci said that he would take a vaccine approved by the FDA. Yesterday, the United States reached 13 million coronavirus cases. We hit 12 million just 6 days ago. This is our 4th million milestone of the month. More than 265,000 Americans are now dead, and more than 90,000 people are hospitalized for the first time since the pandemic began. The national situation is unequivocally exacerbating. But if you just zoom out a bit and look at this from a state standpoint and a local standpoint in tiny cities like Norcator, Kansas, the situation really is getting worse. And as 50 million people just traveled for Thanksgiving this year, doctors are saying, quote, the United States is going to see the darkest days in modern medical history as 95% of the country sees uncontrollable COVID-19 spread and 50 million travel for Thanksgiving. End quote. As a result of the millions of people who traveled for Thanksgiving this year, it is now time to prepare for worst case scenario. I am not being hyperbolic about this. We were warned and people traveled anyway. Now we are about to inevitably see the result of this disastrous behavior, and it is going to be catastrophic. We've got more on that next. Stay with us.
In this world where people are staying at home, many of life's moments are being put on hold. At Carvana, we understand that for some, getting a car just can't wait. That's why the new way to buy and sell a car is also the safer way. At Carvana, you can do it all 100% online from home, with a touchless delivery and pickup process to keep you safe. And for even greater peace of mind, all Carvana cars come with a 7-day return policy. So if you need to keep moving, it's our goal to keep you safe. Check out Carvana, the safer way to buy a car.
Welcome back. So you may recall when you listened to the podcast on last week's episode, on the episode that I published that said, don't travel for Thanksgiving, please stay home. You may recall in that episode that I played for you a clip. I played for you a clip of interviews that MLive, Michigan Live, conducted with doctors and nurses at Sparrow Hospital. Sparrow Hospital is located in Lansing, Michigan. It is at 90% capacity right now. And the reporter who actually went to Lansing, Michigan to conduct those interviews with those doctors, that reporter is Justin Hicks. And Mr. Justin Hicks joins me next. Stay with us.
At a time when we're asked to sacrifice, we step up to do our part. On the home front, on the front lines, to lend a helping hand and hold each other up. We are resilient, vigilant, and we'll get through this because we're better together, even if we're a little farther apart.
Joining me now for the interview is Justin Hicks, a reporter for MLive. Mr. Hicks, thank you so much for coming on the show.
Yeah, absolutely. Thanks for having me.
So your reporting appears to be very well sourced and very informative. Could you please tell us how this all came together?
Just the story in particular, or?
Yes, the story.
Sure. Yeah. So since March, I've been covering coronavirus. I got the opportunity. We've kind of been poking around trying to see if any local hospitals would be willing to let us in to kind of see what a COVID unit looks like. The precautions they're taking, and just what the staffs are going through at this point, 8 months, 9 months into the pandemic. And Sparrow Hospital gave us an opportunity out in Lansing. And so I drove about an hour out there with my photographer and my video guy. And we kind of just spent the afternoon and the evening just kind of watching and asking questions. And the staff was really receptive to just kind of letting us know what's going on and kind of walking us through what they do. And a couple of them stepped into a conference room with us and just kind of did a Q&A and just kind of let us understand and kind of see just what they're going through. It's you can see the exhaustion. I know you played the video a little bit, but you could hear just the exhaustion that some of the staff is going through, and they just keep pushing on because most of them got into this field to help people. So even though they're putting in long hours and they're hearing some folks who might not take the virus as seriously as they should, that's not going to stop these people from caring for anybody and everybody that comes in the door. So,
yeah. In your reporting, you cite, quote, hospitalizations statewide, which had dropped from nearly 4,000 in the spring to 300 in the summer, are back up near 4,000, and it's getting worse. One doctor said, quote, it's probably because it's been going on for so long and I'm so exhausted. It's just too early in this right now to feel like there's a light at the end of the tunnel. How are these frontline healthcare workers coping with this as the current situation is exacerbating?
Yeah, I think each one handles it a little differently. I spoke with some who said that they really just take their days off and try to get away and spend time with family, with their kids.
Mm-hmm.
One respiratory therapist talked about doing kind of his own Facebook show, and he would kind of just do silly things to try to get laughs.
Mm-hmm.
He ate like a ghost pepper and some really stinky fish.
Yeah.
Just to kind of get away. Other times he would just get in the car and just drive, just to try to get away from what they're seeing at work every day. Others talked about fitness, yoga, meditation,
Mm-hmm.
and kind of leaning on each other, going through this, strengthens the bond that they have as colleagues and as team members, and then leaning on their families back home.
Yeah.
Spouses, parents, just friends, people that can help them just get their mind off of, just kind of the sad things they see at work.
Mm-hmm. In your reporting, you cite from doctors that they say that the public support is fading. Did that public support sort of encourage them to keep going? And now that the public support is fading, are they feeling in despair in any way?
So one of the folks I spoke with kind of mentioned early on, she got a thank you note from a friend, and it sits on her fridge, and every day she sees that before she goes to work. Couple different medical healthcare workers talked about seeing the thank yous, the prayers, the different messages that they get on social media, that they see, on TV and the radio, and they talked about those things being beneficial for them and kind of helping to lift their spirits. Others did mention that, early on, maybe in the spring and the summer, you saw more yard signs, signs
Mm-hmm.
of those things that you could feel the support from your community. And as we, people wearing masks and social distancing, and as we get, 6, 7, 8, 9 months into this, you can see the fatigue on just walking around or talking to social media, talking to your friends. You can hear it that people are just tired of this.
Mm-hmm.
They didn't think it was going to go on this long. And so while some people have kind of given up, not necessarily wearing their masks every time, or they might let down their guard and spend more time with friends indoors, the healthcare workers are seeing that too. And so
Mm-hmm.
that take a toll when you go on social media, and you might see the posts one after another saying this is a hoax, or it's just the flu, or misconceptions that as somebody who sees it in the emergency room in the hospital, every day, it's difficult. And it's,
Mm-hmm.
you can't show them what you're going through as a frontline worker. You kind of just have to keep pushing along and to asking people to please help. So,
Yeah. These doctors and nurses have already been through a powerful first wave. Are they using the information learned from the first wave to apply that information to this one to sort of improve?
Absolutely. Yeah. A lot of the folks I've talked to, in the beginning, they didn't know much about the virus. It was a novel virus, meaning this was new.
Mm-hmm.
And so as they got through time, they were able to understand kind of better ways to treat patients. They can kind of have a better understanding for kind of what the course of the virus is, or of the illness is. And so you can kind of see when a patient comes in where they are on that course. And, are they in the early stages? Are they in a more severe stage? And kind of how do you treat them depending on where they are along the timeline? And then certain treatments, certain steroids have had an opportunity to be tested out more. There's more research gone into the virus and We have a better understanding for, how many people may be asymptomatic. So they have gotten better. And even, this visit to the hospital was in November. So 8 months in, and there was a little meeting that the nurses had before the night shift. And they said, remember, we're trying this treatment of laying patients on their stomachs to help them, open up their oxygen flow to breathe a little better. So even this far into the pandemic, they're still kind of learning new things and ways to help patients.
Based on your reporting and on what you've learned, are they only allowing 7 to 9 people in the COVID unit because this is a highly contagious communicable disease, or is that just protocol for right now?
7 to 9 people. So I'm not sure that number. I know that the floor that I was on, there's 30 rooms. And so they had all 30 full at that time. And they had, I think, 4 different floors that each had COVID patients, but they kind of divided it up. So some floors are all COVID and some are not.
Okay.
There's certain elevators that COVID patients would use. It's really just trying to keep them separate from the rest of the population. When we were in there, everyone's got masks on, and they have these rooms set up. So you put on all your personal protective equipment before you go in. And when you open the door, they've got like a vacuum system essentially that pulls the air from the hall into the room instead of letting it out. So ways like that to make it so they can limit contamination and the spread even in the healthcare facilities.
When you went in to do this report, did you have to, I'm sure you had to put on PPE. Did that feel surreal to you as you were visualizing this in person?
I expected to have to wear more. Pretty much just had the mask on. I didn't go into any of the COVID rooms themselves. I kind of walked through the hallways, and by each door, there's 2 little windows so you can see into a room. When a doctor goes in, you can kind of see them interacting with the patient, and there's computer screens on the outside of the room to watch. But I didn't actually go into the rooms, and therefore I didn't have to put on, the gloves, the gown, the face mask. But it was definitely surreal just to see all the steps that healthcare workers have to take in order to make sure that they're safe, because they go home to their families and they don't want any chance of infecting their own family.
Yeah. Michigan is continuing to see an exponential increase in coronavirus cases. In terms of holiday travel and Thanksgiving just recently, it's inevitable that there will be a new flood of patients. How are other hospitals, and Sparrow specifically, which is already at 90% capacity, going to cope with this frightening reality?
Yeah, that's a good question. Initially when we had that first wave, we saw in the Metro Detroit area, the building and the opening up of these kind of new hospital areas where there was hospital beds, and they were able to bring in medical teams from outside the state or from other areas of the state to help out, because where it was hitting really hard in Detroit, there were other areas that weren't seeing that first wave as much. What's challenging about this time around is that across the state, it's hitting everyone. Country, it's hitting everyone. So you don't really have those areas where there's not much COVID going on and you can move doctors and nurses to help elsewhere. Capacity wise, the concern isn't so much the bed space physically, it's the staffing, and it's making sure that there's enough staffing to care for those patients. And so that's a really good question on what are they going to do if this second wave, and as we get into the holidays and into the flu season, if we see hospitalizations tick up higher, what's that going to look like? And I think concern for them, and that's why they're just at this point they're just down to begging everyday people to wear masks, to avoid other people that are not in their homes, and to just do those little things to spread so we don't have to get there.
Once again, my guest is Justin Hicks, a reporter for MLive. Mr. Hicks, thank you so much for coming on the show. I really appreciate all the work that you do at MLive. You guys are fantastic journalists. Thank you again for coming on the show.
Absolutely, Jeremiah. Thanks for having me.
Thank you.
Introducing Tide Power Pods
with cat and net. I love how much I can stuff into these machines. But that is such a large load. Don't the stains sneak through? Please. New Tide Power Pods can clean that whole situation. You just toss it in before the close. It's like 2 regular Tide Pods and then some power and then even more power. With 50% more cleaning power, even your large load got clean. How many kids do you have?
Girl, I lost track. There's a lot of kids. And then there's a husband, and there's me.
That's a lot of clothes.
The year was 1967, and they were presenting the new Boeing 737.
The official 737 christening ceremony took place in the new final assembly building on January 17, 1967.
Powerful engines, a greater wing surface, and faster speeds. The new Boeing 737 was the product of close cooperation between Boeing and Lufthansa. In the mid-60s, it joined the Lufthansa's Boeing family and remains today the best-selling commercial airline.
The Boeing 737, 1967. That was the case. It was a very, very popular plane. Very, very popular. That was the case until what transpired in 2018, when the FAA had to ground all Boeing 737s because of these 2 catastrophic, disastrous, emotionally draining plane crashes that ultimately killed 346 people. In the first crash on October 29, 2018, a Lion Air Flight 610 dove into the Java Seas 13 minutes after takeoff from Jakarta, Indonesia, killing 189 people. The flight crew made a distress call shortly before losing control. The aircraft was almost brand new, having arrived at Lion Air 3 months earlier. The second crash occurred on March 10th, 2019, when Ethiopian Airlines Flight 302 departed ADDIS Ababa Bull International Airport, bound for Nairobi, Kenya. Just after takeoff, the pilot radioed a distress call and was given immediate clearance to return and land. But before the crew could make it back, the aircraft crashed 40 minutes from the airport, 6 minutes after it left the runway. Aboard were 149 passengers, 8 crew members. The aircraft involved was only 4 months old. The Boeing 737 MAX. It first flew in 1967. This was reporting, by the way, from CNET.com. Well, the FAA has now allowed those planes, they have now lifted that halting plane order, and now those planes can now fly again. And this has sparked infuriation and emotion as people are recalling their loved ones and how they died during these 2 years. This was a report from ABC News yesterday.
Now to the year-long ABC News investigation into the 2 deadly crashes involving Boeing 737 MAX jets. The tragedies grounding the fleet worldwide for nearly 2 years. The first jets are now scheduled to return to the sky 1 month from tomorrow. Here's ABC's Bob Woodruff.
Boeing 737 MAX, once the fastest-selling jetliner in Boeing history, now cleared again for takeoff after 2 deadly incidents. October 29, 2018, a Lion Air flight departing from Jakarta, Indonesia, plummeted into the Java Sea. 189 souls aboard perished. Just 4 months later, 157 people were killed when an Ethiopian Airlines flight crashed. Both incidents blamed in part on flight control software called MCAS.
So it was MCAS, it was the computer against the pilot.
Yes, and the way MCAS was designed, it was given the control authority to do it as many times as necessary. In other words, it was given the power to try to kill them, essentially, until it finally succeeded.
Boeing's fleet of 737 MAX aircraft grounded worldwide, prompting a congressional investigation and a criminal investigation by the Department of Justice. Amin Tamrat lost his father on the Ethiopian flight.
What really shocks me is their greed. I don't know how they can still, sleep at night.
Since then, Boeing told ABC News they have made a series of meaningful changes to strengthen our company's safety practices and culture. As well as updating the flight control system, MCAS now relies on 2 sensors and will only activate a single time, and pilots will also be required to complete flight simulator training.
I do think the 737 is a safe airplane. This MCAS thing was bad. I think that trust is going to be really hard to get back at this point.
Families of those who died in the crashes are outraged. Nadia Milleron and Michael Stumo lost their daughter, 24-year-old Samia, in the Ethiopian crash. They have filed a wrongful death lawsuit against the company.
This is Samia's room. I can't believe that this is remained untouched for more than a year. I look for Samia all the time. I call Samia. Sometimes I'm in the house by myself. I just shout, Samia, Samia, where are you? Where are you, Samia? But Boeing took her.
Once again, a report from ABC News. We'll be right back.
Meet the Ninja Foodi Air Fry Oven. Make fast, family-sized meals in the time it takes some ovens to preheat. With Ninja's superheated air, you can air fry for extra crispy, guilt-free, delicious results. And because it's a Ninja Foodi, it can do things that no other oven can. And even flip up and out of the way. The Ninja Foodi Air Fry Oven, the oven that crisps and flips away.
The great question of the 70s is, shall we surrender to our surroundings, or shall we make our peace with nature and begin to make reparations for the damage we have done to our air, to our land, and to our water?
That was President Richard Nixon back in the 1970s. And whatever you may think of President Richard Nixon was one of America's sort of greenest presidents, you could say, or one of America's presidents that has done just remarkable work for the environment. President Richard Nixon helped create the EPA. President Richard Nixon did lots of stuff on the environment, which was just remarkable. Some things that we still quote and use and that are still in the federal government today. The Trump administration has just taken like a hammer, or not even a hammer, but like a chalking block or something to the similar, to climate change and to other things, as well as the environment. We continue to see these headlines of what the Trump administration is doing as they are getting ready to exit the White House. As they are getting ready to exit the White House, they are just delivering and just getting rid of lots of environmental protections. Well, today we get another one, because yesterday multiple news organizations, including The Hill, reported, quote, Trump administration proceeds with rollback of bird protections despite objections of scientists and environmentalists. The article continues, quote, the Trump administration on Friday advanced its plan to cut federal regulation protections for birds, despite criticism from scientists and former federal officials that the move will likely be severely detrimental to the United States bird population. The U.S. Fish and Wildlife Service on Friday released its final environmental impact statement on the proposed change to the 1918 Migratory Bird Treaty. Migratory Bird Treaty Act, also known as MBTA, that would greatly limit federal authority to prosecute industries for practices that kill migratory birds. The act was first passed, quote, to stop the unregulated killing of migratory birds, according to a Friday's report. Under the legislation, the Fish and Wildlife Service regulates the taking of migratory birds, which includes, quote, to pursue, hunt, shoot, wound, kill, trap, capture, collect, or attempt to hunt, shoot, wound, kill, trap, capture, or collect, end quote. The proposed change seeks to clarify the scope of the definition, although many have pointed out that the change will scale back federal protections. Authority for the threats birds face from industry, including electrocution on power lines, wind turbines that knock them from the air, and oil-filled waste pits where landing birds can die in toxic water. While the Fish and Wildlife Service regulatory change will have, quote, negative impacts on migratory birds as well as other biological resources, cultural resources, and ecosystem services, the report states that the proposed change is, quote, necessary to improve consistency and efficiency in environment and enforcement of the MBTA's prohibitions across the country, and inform the public, businesses, government agencies, and other entities what is and what is not prohibited under the MBTA. According to the Fish and Wildlife Service and recent studies, industry operations kill an estimated 450 million to 1.1 billion birds annually out of approximately 7 billion birds in North America. A federal judge in New York in August rejected the Trump administration's push for the regulation change, although the agency has pushed forward with the change regardless. According to the Associated Press, federal officials advanced the bird treaty changes to the White House, one of the final steps before adoption, just 2 days after President-elect Joe Biden was projected the winner of the 2020 presidential election. End quote. So this has just taken place. The Trump administration, what's that headline again? Quote, Trump administration proceeds with rollbacks of bird protections despite objections of scientists and environmentalists. They are continuing. This is happening. As Rachel Maddow says on MSNBC, watch what they do, not what they say. Thank you again for listening to this episode of the Jeremiah Patterson Show. I will see you on tomorrow's episode. I'll see you then. Have a great day.